All right, so we are back for another member interview with the J.R. Gladys Society. And again, we want to talk about why we're doing this. We want to get engaged with our members, want our members to actually get to know each other. And even our trainees, we want our trainees to be um, comfortable reaching out to each other and to our members wherever they are on their interview trail, even if they haven't considered certain places. Hopefully, these videos and listening to the stories of the members who've been there before them will help them get an idea of, maybe what the culture is on the ground and going to different places to interview and possibly train. So again, I am Alvin Jones. I'm a pediatric orthopedic surgeon. I work at Dayton Children's Hospital in Ohio. And Jamil, go ahead and give us your introduction.
Hey, how's it going, everyone? My name is Jamil Kendall. I'm a current PGY3 at OHSU, Oregon Health and Science University out in Portland, Oregon. And I'd like to welcome. Yeah, go ahead. Yeah. I'd like to welcome with us today Dr. Corey Montgomery. He's an orthopedic oncologist from the University of Arkansas for Medical Sciences down in Little Rock, as well as Arkansas Children's. She went to Alcorn State down in Mississippi, University of Tennessee for medical school, and then University of Arkansas for his orthopedic training. Stopped over in Miami for his oncology fellowship, is now back in Arkansas serving the community as one of two orthopedic oncologists in the state. So thank you for joining us today, Dr. Montgomery.
My pleasure to be here. I think this is a phenomenal opportunity and a phenomenal program. So.
Yeah. So
great.
Yeah. How about you tell us a little bit more about yourself, your background, and how you made your journey towards orthopedics?
So I'm originally from South Mississippi, so I'm kind of a farm boy. I grew up on a farm, pigs, chickens, and all that types of things like that. And actually, growing up, I had really not a lot of interest in becoming a doctor. I actually was going to be a vet, and so I got into high school and had some various experiences with some various teachers, and they kind of say, well, I want you to pursue medicine. And it kind of went from there. And so I think, once I got to med school, with growing up in a small community, really didn't have any experience in any type of surgical subspecialties. And, it kind of went from HEMONC and went to ID. And then, actually I was going to do HEMONC for the longest period of time, my first 2 years in med school. And I got some exposures, and I went to University of California for like a 1 month externship, and kind of realized that medicine maybe wasn't the best thing for me. And I got back to Memphis and I did my general surgery rotation. It was phenomenal. I got the chance to kind of use my hands, but they were kind of like really miserable. They were kind of like, they didn't seem very happy what they were doing. And I was like, man, I love operating, but maybe general surgery is not for me. And that first week of we have like a surgical subspecialty rotation, which you do ortho, ophthalmology, urology, and ENT. And my first week was all ortho, and it was like, wow, this is great. And it kind of went from there. I got it really started late in the game. I think I really didn't decide to do ortho until like maybe April of my third year. And it kind of went from there. I had the grades, and I had, some other things behind me. So I did well in med school, and it was kind of like a, fairly easy transition from there. So.
Oh, that's excellent. Yeah, I agree. When I was training, I thought I wanted to do general surgery for a while too. And it was actually a lot of my friends who were telling me, you don't, you don't. And ortho is it's like the sunny side of surgery. It's
yes,
so much
better. It definitely is.
Yeah. I don't envision doing anything else. And it's like, and general surgery is like, seem like they're miserable and they're always unhappy and complaining about stuff. And the ortho guys and gals are like, oh, this is great. We had a great day. And they're all happy. I'm like, something's up with this. But I didn't see a lot of people like us though. So that was the other thing that I kind of realized that, hey, I didn't see any minority orthopedic surgeons at all. And so that didn't deter me at all, but it was a little bit, concerning. So.
And so you came late to the game, but you said you were already qualified, like prepared. So you had already had the grades, you had the step scores ready, and you kind of just, it was easy for you to make that transition.
Yeah, it was. I had high GPA. I had AOA in med school. So it was like, I didn't necessarily have to kind of fight some of the other things that some of the students I encounter, dealing with grade issues or board score issues. And I didn't have to deal with that at all. So.
That's excellent. Now, so you are a orthopedic oncologist, correct?
Yes.
And so tell us how you came to that realization that that's what you wanted to do.
So it's interesting. I said earlier that, I had an interest in hem-onc. And so when I got to ortho, I realized there was actually a subset of ortho called orthopedic oncology. And that interest in oncology kind of stayed with me. And it was just kind of using that interest slightly differently. Instead of, using it from a medical side of correcting oncological problems, is using more of a surgical aspect of it. And so it was once again a very easy transition as well. Because actually, even before I got into residency, I kind of knew that if I did get into residency, I was going to do orthopedic oncology. So.
Yeah. Okay. I'm actually on my tumor rotation right now. Yeah, and it's interesting. It's a different kind of a different view of orthopedics with how many teams kind of come together to come to one agreement on how best to treat these things. It's been fun so far.
Yeah, it's definitely a team approach. You get yourself, you have the pathologist, you have the radiologist, you have the oncologist, you have the radiation oncologist. And so it's like you get to talk to everybody and get their insight on, okay, do we do the radiation first or radiation afterwards? I love sarcoma conference. We get to talk about very rare stuff, and you can actually even tell the patient that, hey, I've kind of, talked to various people, and people feel more comfortable when you've had like a team approach. And, I love that. But the other aspect of it is that, it is kind of depressing when you have to kind of, talk to someone about, limb salvage versus amputation versus metastatic disease. So it's one of the highlights I think of is it takes a special person, I think, to kind of be able to kind of, navigate those waters of discussion and still being very enthusiastic about the overall outcome. And then also the rebuilding aspect. So I think it's kind of like the best of all the aspects of orthopedics is that you're rebuilding stuff, you're providing hope. I don't foresee myself in any other subspecialties of orthopedics are doing it as well. So we kind of get to operate everywhere as well. So.
Yeah, you probably have a wide network that you cover from most of the orthopedic oncologists. They tend to pull from a wide range of people because y'all are so specialized at what you do that most of the other orthopedists will send things towards you, to kind of take care of that.
Yeah.
So you probably do get a lot.
It's kind of it's a small community as well. Majority of us know each other and know each other in the various states, and so kind of a small group of us. And I kind of feel like, hey, if you want a second opinion, I can kind of call my friends up in MD Anderson or in Memphis or in WashU or whoever, and just kind of like, hey, I got this guy. They were thinking of getting a second opinion there, and so I think that's one of the unique aspects of it as well. Everyone kind of knows each other or know about someone else in the surrounding states. So.
That's awesome. Yeah, I remember that was one of the big things I loved about the orthopedic oncology rotation as well, was the team aspect of it, going to the conferences, hearing everybody's opinion, coming to like a general consensus. And so I love that part about it too. But like you said, it takes somebody special to be able to go in there in that situation where, it could be life-threatening, limb-threatening. So yeah, kudos to you on being that special person. Yeah. You know what? I did want to talk to you also about the other role that you play at your university. Right now, you're currently the assistant program director for the residency program.
Yes.
And kind of tell us a little bit about that and how you are able to impact the residents' lives, and kind of what you like to teach and how you tailor your approach to guiding your residents.
So I've been doing it for roughly 7 years now, and we kind of shared before, I'm going to be officially the program director starting in July, so that my hat will change in a few months. So I think one of the unique things about that is really influencing the future of the society, and I think that's one of the unique things. I think that as a program director, we're very integrated into selecting who the future orthopedic surgeons are going to be, and also allowing for them to participate in that maturation process as well. And so, with being the assistant, my main roles was kind of like working with the med students and doing some of the resident interaction, but mainly was the med students. And so I was really responsible for selecting the applicants, and so I had a strong hand of trying to influence in that. And I would honestly say our program, I think we do an extremely good job of attempting to recruit as many minorities as possible. And so what I developed a couple of years ago is trying to make the selection process as unbiased as possible. And so what we've done at our program is try every applicant that applies to our program, you essentially assign a numerical value, and you actually get extra points for being a minority. So so if you're equivalent to your non-minority colleagues, you actually will get extra points, and then from that pool, we will actually select out who we interview. And so, we've definitely tried hard. So one of the big things I think about being in Little Rock or one of the more southern states is this historical concern about racism and et cetera. And we were aware of that. And so we've tried to work really hard to try and change that narrative as much as possible. And currently we even have a minority stipend to try and help encourage minorities to come to Little Rock as well. So it's actually for those who may be listening to this, and if you're looking for an opportunity to spend the summer somewhere and you want an all expense paid opportunity to do orthopedic rotation, you can come to Little Rock and we'll pay for your travel, we'll pay for your housing, and you get to spend a month at a, I think we are emerging program that roughly, I think we have 31 faculty members now, and we pretty much cover every aspect. So I think we're a super program. We're looking for more minorities, and particularly with me, taking the lead on the residency, I think that's going to even add more fuel for us to be more inclusive and more diverse as much as possible.
Wow, that's good to know. Yeah, I think we're going to be able to get a lot more people applying once we get these videos out there. That's awesome. So tell us a little bit about, because that is one of the hesitancies. I did not train in the southern states. I actually trained in West Virginia, though, which again, people will get probably the same mentality, or bring to mind the same cognitive thought of maybe a homogeneous society that's probably going to look at this piece of pepper and the salt in a very unwelcoming light. But again, I honestly did not have that problem. Tell us a little bit about your training and where you've been, and have you had any of those I guess challenging interactions that you would expect, and how you really face those or deal with those as a Black man in a majority white, or even in this kind of caste type society that we live in?
So it's an interesting question. I think some of it's perspective. If you talk to my wife, she's like, well, you kind of view things maybe slightly differently, and based upon how you encounter folk. Definitely, I've had experiences from one of my patients. I just told this story yesterday to one of my best friends about I was taking care of a older white lady and white male, And the white male, he had a particular problem. He had this bad trauma and he had a bad osteomyelitis, and none of the local docs wanted to take care of him. So being an orthopedic oncologist, I necessarily don't have a lot of fear factor for certain things, and I would take care of him whenever he would develop this recurring infection. And so she was, describing me to her husband, who was this older white guy, and she was like, yeah, Dick, Dr. Montgomery's that super nice guy that we all like, he's that young colored doctor. And I know she, I was there and the white nurse was there, and I know she didn't necessarily mean it in a derogatory manner, but just the terminology itself was like, oh, she said the colored word, but she was meaning it. So I just think some of that could have, I could have easily took it in, like, oh my God, I'm not going to take care of this guy anymore because he called me colored. But I took it as, there is definitely parts of Arkansas that are very rural and very minority exclusive. And so that's how I look at it. And so you have to take in perspective that you may encounter some patients that may not necessarily mean ill towards you, but still may use that terminology as well. Another situation that I maybe I should have acted differently. I was getting ready to start a case, and Kedrick is my scrub. So I have, we always work together at the university. And this young white anesthesia resident, which I guess I never met before, came into the room, and we were about to start the case. And I said, kid, pass me the knife, let's get started. And I'm about to make the incision. He said, whoa, what's going on? What are you doing? You can't start the case until the attending gets there. And I about to say something, and my white nurse friends already like, whoa, that's Dr. Montgomery. I know you have, it's your first rotation here, and you've been here. And before I could say anything, she had kind of diffused the situation. And so I think that's some of the things that you may face, unfortunately. And I think, we probably had similar experiences, but those are very rare and uncommon experiences I've had. And so I definitely think the majority of my experiences here have been extremely positive. I have patients that bake me cakes, they bring me food, they bake me jams, they bake me jellies. And that majority of my white patients that do that, and so I've actually had extremely positive experience, but I am from the South. And so I grew up here and I kind of know the routine, et cetera. So some of that may be easier for me to navigate. But, and we have some minority residents as well. And so, it's nice to kind of share the experiences, talk about, those issues as well. And so I try and be as open as possible and have an open door policy about all the things. And so if one of my residents have an issue, I'll say, hey, talk to me, what can we do to make it better? And my chair is extremely open and helpful, and make sure that we have issues. And I think that's probably one of the things that I would say for those who are looking for a orthopedic program. Look for a program that's going to be seems like that the program director and the chairs are going to be open to listening, and if you have issues, going to fight to help make those issues better. They might not necessarily make it perfect, but they're going to fight and listen to you at least to try to make those issues better. And that's just part of being in society today, is that we're all going to face issues, but you want to make sure you go to a program that's going to be helpful and try and make those issues as easy and as possible for you to understand and navigate.
That's good. Yeah, sounds like you all have a nice support network there for minority residents and trainees. So that's good. That's good to know. Helpful, I think, for our trainees to hear. So I want to shift the conversation, though, and find out what you like to do outside of medicine. Anything that you're doing kind of in your own life?
So I've been married for 16 years. I have 4 kids. So man, when I get home,
wow.
10-year-old, I have an 8-year-old, a 5-year-old, and a 2-year-old. And it's like, So my home life, or my work away from work, is just hanging out with the kids. I think right now my wife has 4 kids at the soccer game right now. And so it's just raising the next generation of Montgomerys. I would say that's probably my second job. So.
Awesome. And so what type of sports are they into?
Oh, me and my wife, well, I keep saying my wife, so because she has them in everything. So the girls are doing gymnastics. I have 2 girls and I have 2 boys, gymnastics, dance, taekwondo, you name it. We probably have done it. Basketball, football, flag football. We try and keep them as engaged as possible. So my wife is a superstar. So she.
And so
So I got to give her all the props.
Is your wife working too?
She's actually a full-time.
Is your wife working too?
Yeah, she's a full-time PhD, so she does that, and we have a nanny, which really makes it extremely easier to do as well. And we have my mother-in-law and in-laws are here as well. So once again, a support system that makes it easier for you to accomplish your goals. And I think that's part of being successful, is that you can't do it alone, and you have to have people willing to help you and make your life easier. And I definitely say for those who don't have a nanny, man, it's a game changer. I really think that whenever to kind of watch you and you feel comfortable in that environment and you still keep doing what you like to do and they like doing it, I think it's wonderful. So X money well spent.
Yeah, exactly. If you can get somebody to help you do something that takes time away from your life. Even like lawn care. Yep, lawn care, cleaning the house, those type of things, those are worth it. And that's okay, the dog's fine.
Sorry.
But I was just thinking, listening to that, 4 kids and all the different sports, it sounds like a full-time job, with all the sports and like probably, traveling around from one event to the next. I was just kudos to you and your wife, because when you have 2 people working full-time, trying to add that extra job of transporting the kids all around, that's tough. That gets tough.
Yeah, I agree.
So Jamil, we typically like to ask some questions from a trainee standpoint. So go ahead and ask Dr. Montgomery your question.
Yeah. So you've kind of been on this journey and you've navigated a lot of things to get to the point that you've gotten to now, and I'm sure you've learned a few things on the way. Is there anything that you could share for the residents, medical students that may be watching, things that you know now that you wish you knew when you were in our shoes?
Yeah, I think a few things, and I'll kind of take it from a level of training. So if you are a medical student, I definitely would say probably some of the key attributes of being successful in orthopedics is making sure that you have your grades up to par. I definitely think you need to, it may not necessarily be as important in 2023, your board scores. I think those are, aspects of medicine that will keep you out of orthopedics. And so I think once you are able to achieve, getting the appropriate scores, I think that door can be wide open for you, because what I've sensed that in regards to, candidates that are, very, that have those attributes, I think you can probably go wherever you want to and train, because I think more and more programs are realizing the value of having a diverse residency program, and they actually are highly attracting those and recruiting those applicants. For those who have actually probably junior level orthopedic residents, I would say to you, kind of figure out what you want to do with your life, but at the same time, don't choose a pathway too soon. As I said earlier, I kind of chose early on, but at the same time, I studied really hard for my hand. I studied really hard for recon. And so don't necessarily pigeonhole yourself into, beginning so specialized early on in your training. I would say for the 3, 4s and the 5s, start looking for a job. Start thinking about that next level, because sometimes jobs will, people will sign 3 or 4 years in advance, and sometimes you can get a stipend while you're in residency program, and et cetera. For the junior faculty members, of those, I'm 10 years now, so I'm kind of like mid-career. I would say just make sure that you're happy in a city, and make sure you start looking for the appropriate support system, because once again, you kind of get a little bit on cruise control, I think around 10, 11, 12, and 13, and then start thinking about investments, start thinking about planning for retirement. And so I'm actually thinking about retirement now, because I've been doing this for 10 years and I don't plan to be working forever. I'm looking for the right investments, and I think definitely orthopedics will afford you the opportunity to have monies and resources to do certain things. But at the same time, when you start working, you want to make sure you be able to invest that money and say, you know what, I want to use that money to try and build something for the future and actually build something for your kids as well, because I think this generational wealth is so important for us to continue being successful. And I think opportunities like what I have, my kids will have that other side that other may not have because they didn't necessarily have the resources that I had growing up. So
thank you.
Yes, thank you. Very valuable.
Hope I answered your question.
Yeah, no, that was very good. Good. And then, you know, the last two questions we typically end on is really asking, as a society, the J.R. Gladden Society, we want to really get to know, you know, what can we do better, and what can we do to bring value to our members? And then, you know, is there anything that you feel that you could contribute to the organization?
I think things like this are phenomenal. I really do. I think this is that things that are able to use the older members and educate, because I think that's just minority experiences in general for us to kind of reflect back on those in the past that have been successful. And I think this is an opportunity for us to easy access that information and be able to distribute easily to other members. For me, I think for the older members, I think we have to be more engaged and active, because sometimes once you get on cruise control, you kind of lose your focus a little bit. And that's kind of one of the limitations of cruise control, is that I forget to kind of give back without necessarily being asked. We should ourselves be very proactive in doing that, but sometimes we're more reactive. And so I'm extremely happy that you're all able to reach out to me and afford me the opportunity to give back from a knowledge standpoint to some of the people who are behind me. So I definitely think that we older members need to be more engaged in giving back. And that's not just with interviews, that's actually with finances as well, because once again, we're more established and we have more finances and more ability to give back to individuals that may not necessarily have the resources that I currently have.
Awesome. Well, thank you very much, Dr. Montgomery. This was an excellent interview. You're a wealth of knowledge, and definitely when I see you at some of the meetings, I'm going to make sure I reach out, say hello, and hopefully over the next few years we get to know each other better. I want to also just tell our members again, if you're interested in being interviewed, please reach out to us at info@gladdensociety.com and just let us know your interest, and we'll also get you on these Zoom meetings so that we can get to know each other better. All right. Thanks again, Dr. Montgomery.
Man, it's my pleasure. Been a highlight of my day. So I thank you all for giving me this opportunity. So
thanks so much. Much appreciated.
Right. My pleasure. Jamil, good luck to you. What do you plan on doing?
I think I'm leaning towards joints.
Okay.
Yeah. So getting ready in the fall, start working on fellowship applications.
Okay. Well, Good luck, man. I wish you the best. So
I appreciate it. Thank you.